Well, thank you so much, Pastor Brooks. Dr. Brooks, thank you for your work. Thank you for this terrific center. And it's a great day. This really is. It's a great day because what we're really announcing when we get all through it, and I'm going to talk a little bit about it, but is hundreds of thousands of people are going to be covered, continue to be covered by Medicaid as a result of doing a careful job about redeterminations. That's a big deal. Lots of states didn't do that, and we're one of the best in the country, so let me get at it. I want to recognize and thank the Lawndale Christian Health Center for its kindness in hosting us this morning, its partnership, and serving the healthcare needs of people who sometimes desperately need it. And this is the only place that's available to them, and this place is open to them all the time. And I'm just very pleased for the state to be partnered with you in this endeavor. As all of you know, Medicaid renewals annually are reviewed to determine each person's continued eligibility for the program. But during the COVID-19 pandemic, the federal government wanted to be sure that no one would go without health care. So they lowered the bureaucratic barriers, which allowed expanded coverage. And they paused Medicaid redeterminations for millions of people in Illinois and tens of millions across the entire country. Last year, at the end of the pandemic, every state was required to start the redetermination process. And with so many newly covered clients, many states struggled in that endeavor. Still, other states used the starting of redeterminations as an opportunity to push vulnerable residents off of their Medicaid rolls. They didn't want to have to pay for them. Here in Illinois, we took a very different approach. We examined every covered person, followed all the rules, and worked assiduously to maintain health care coverage for as many eligible people as possible. That required processing, contacting, and tracking 3.8 million residents across the state to maximize eligible enrollment. And let me be clear, for those of us who believe in universal health care, making sure that everybody has access to a doctor, this is hugely important work. And what we're announcing and talking about today is really an expansion toward the ultimate goal, in my view, which is universal coverage. Across the nation, it was clear that there would be millions of people who would become ineligible for legitimate reasons, like they had found a well-paying job or found other insurance coverage. That's a good outcome. But millions of others, for example, those who are homeless or those who have geographic or technology barriers or whose disabilities had prevented them from previously applying for Medicaid coverage, were in danger now of being thrown off their newly found Medicaid coverage despite being eligible. So how your state handles Medicaid redeterminations has a huge impact on whether your population gets health care coverage. Retaining all those who are Medicaid eligible was our goal here in Illinois. Today, as we close out this process, I am proud to announce that Illinois is among the leading states in the country with a retention rate of 73%, one of the highest in the entire nation. You all know that I'm a competitive person, so I won't pass up the chance to point out that we vastly outpaced states like Florida and Texas and New York and Utah and Colorado, and the list goes on and on of states that we outpaced and did a better job of getting redeterminations positively redetermined. Hundreds of thousands of Illinoisans, hundreds of thousands, from those in rural areas living in extreme poverty to those who are unhoused, are able to keep their coverage because of the tireless work of the people up here with me today and many, many dedicated public servants across the state. And I would like to give a special note of appreciation to our frontline caseworkers like Maria Mendez, who's here today and you'll hear from shortly, who are the unsung champions of these outcomes. From start to finish, this was an all-out, all-hands-on-deck effort. We brought together officials at the state and national level, community health partners, patient advocates, civic groups, public health professionals, and more to make this process as smooth as possible and keep Illinois patients informed and protected. We made every effort to automate renewals, give customers more time and information, and to build the capacity necessary to manage the caseload and work to avoid letting people slip through the cracks. This came alongside a massive statewide advertising and outreach campaign across a range of media in every corner of the state and in 15 different languages. We added text messaging capabilities and telephone helpline improvements to make it as convenient as possible for Illinoisans. Thorough, efficient, and innovative are the words to describe the work of this team of extraordinary public servants. This is what good government looks like. It took a village to get it done, and there are so many people to thank: Secretary Dulce Quintero and the team at Department of Human Services, Director Lizzie Whitehorn and the Department of Healthcare and Family Services, our federal partners at the Center for Medicare and Medicaid Services, every community organization, medical provider, every legislative ally like Senator Selena Villanueva, who's joined us here on stage today, and all the folks in between who pulled together to make this Herculean effort possible. This month marks the final cohort to go through the resumed post-public health emergency redetermination process, but our work is not finished. We will continue our extensive outreach to help every eligible Illinoisan get the coverage they deserve and keep the coverage they deserve. In fact, as part of that commitment, we are seeking federal approval to make permanent many of the capacity and efficiency boosting practices that we adopted during the last year. I'm proud to stand alongside all of these folks today, many of you in the audience today, and I look forward to doing so in the work ahead. So thank you for your commitment to keeping Illinois strong and healthy and prosperous. And with that, I am pleased to hand it over to a great leader in this work, someone who left my office, the governor's office, to go take over one of the most important agencies of state government, and that's the director of the Department of Healthcare and Family Services, Lizzie Whitehorn. Lizzie?
Good morning. Thank you, Pastor Brooks at Lawndale Christian Health Center, for hosting us. Thank you, Governor, for your leadership through the COVID-19 pandemic and the unwinding from the public health emergency. I'm so happy to be with all of you this morning to talk about everything we have been doing in state government and with our partners to keep as many Illinois Medicaid customers as possible covered as we unwind from the protections that were in place during the pandemic. I'm thrilled to celebrate all of the hard work and to highlight the successes we've achieved together. Those successes include the fact that, to date, as the governor mentioned, 73% of Illinois Medicaid enrollees have maintained their health care coverage. That's more than 2.6 million people. And Illinois is also leading the Midwest in customer retention through the unwinding. So how did we get here? At the beginning of the pandemic, the federal government implemented the continuous Medicaid coverage requirement, directing states to stop the regular practice of annual redeterminations for Medicaid customers. These are the eligibility checks we do to make sure enrollees still meet all the requirements to continue receiving benefits. The federal government did this to make sure people could access health care during an unprecedented pandemic. During the 3 years that the continuous coverage requirement was in place, our Medicaid enrollee population in Illinois grew by nearly 1 million people. No Medicaid customers went through the redetermination process during those 3 years, and those who enrolled in Medicaid for the first time during the pandemic had never been through a redetermination at all. A little over a year ago, the federal government announced that the continuous coverage requirement would end effective March 31st, 2023. Just as COVID-19 presented a massive challenge, so did protecting coverage for eligible customers through the unwinding from policies that were put in place during the public health emergency. Making sure that people understood the steps they needed to take to keep their coverage, like updating their address on file with the state and responding to their redetermination by their due date, required us to do extensive and ongoing outreach to make people aware of the coming change. The stakes of missing one of these steps are very high because it could mean the difference between keeping Medicaid for the next year or losing health care coverage. And we know that lack of health care coverage can lead to other negative outcomes for low-income people, contributing to challenges like medical debt and homelessness. Therefore, we initiated our statewide Ready to Renew advertising and outreach campaign, which has been live on social media, radio, billboards, and more to amplify the importance of customers renewing their coverage. We began messaging about redeterminations months ahead of implementation to prepare our customers. I'm extremely proud to say that consistently over the past year, Illinois has remained among the top 10 states with the highest customer retention rates. I especially want to take a moment to recognize the HFS staff for their tireless efforts and commitment to keeping eligible customers enrolled. This has been a major undertaking, and we didn't do it alone. It was in partnership with the Department of Human Services, our Medicaid Managed Care Organization partners, as well as healthcare providers, community organizations, advocates, legislators, and other stakeholders. All of these partners have been instrumental in helping us spread the word to the diverse Medicaid enrollee population across Illinois, engaging in layers of outreach to help people prepare for their renewals and connect with difficult-to-reach populations. During the pandemic, the federal government also allowed states to use many flexibilities in the enrollment process to make it easier for customers on the front end and states on the back end. Many of these flexibilities continued to be available during the unwinding, and we in Illinois took advantage of many of them. In doing this, we've learned a lot about how to make the process easier for our customers. So as we return to the standard practice of annual redeterminations for all Medicaid customers, we're also making permanent some of the flexibilities we implemented over the past several years. Late last week, the Federal Centers for Medicare and Medicaid Services approved several of our requests, including to continue accepting customer attestation for income and insured status where electronic verification is not available. We will also keep the reasonable compatibility threshold at 30%. This is a check that compares someone's self-reported income with information available from electronic data sources to determine whether they meet the Medicaid income eligibility level. Before the flexibility was implemented, the threshold was 5%. Federal CMS also just announced that flexibilities for some ex parte renewals have been extended through June 2025. Ex parte renewals are automated renewals that can be done in cases where there is enough data available to verify a customer's eligibility and renew their coverage without paperwork. This federal extension applies to zero-income customers and will also make it easier for aged, blind, and disabled customers to be approved via ex parte. We have been seeking approval for ex parte review for zero-income customers for years and are proud that our advocacy has helped change policy at the national level. These changes are intended to keep renewing coverage easier for customers on an ongoing basis as we return to the traditional practice of annual Medicaid redeterminations. There is no doubt in my mind that all of the hard work by our committed state workers and all of our many partners within and outside of state government has contributed to so many Illinoisans keeping their health care coverage over the past year. And now I'll hand it over to a great partner and colleague, Secretary Dulce.
Hello, good morning, buenos dias. It is so wonderful to be here. I want to begin thanking the governor and his amazing team for all their support. And a special shout out to my predecessor and dear friend, Deputy Governor Grace Ho. I also want to thank the Director of Department of Healthcare and Family Services, Lizzie Whitehorn. We appreciate the partnership and support your team has providing and working through so many of the challenges we faced during the unwinding. At the nearby West Ogden Avenue Family and Community Resource Center and all of the other centers around the state, Human services caseworkers assist individuals and families with applications for a wide variety of services, including benefits that support access to health care. IDHS assists nearly 2,959,000 people in Illinois who receive medical benefits, and about 23% of people in Illinois. I just can't, I will be remiss, but I want to give a special shout out. We have some of my colleagues here from IDHS that are standing right here, and I just really want to thank you for your service, who have continued to help our customers to ensure coverage remains active. IDHS has implemented text messaging, which includes reminders to update your addresses and complete your redetermination. IDHS also created a new option, IDHS Helpline, to expedite assistance for those looking to complete their redetermination via telephone. Additionally, the line can now identify whether the callers need to complete their redetermination and ask them to complete it via telephone. Since May of 2023, IDHS has taken 78,403 telephonic medical redetermination calls. By making these improvements, we're doing our best to be proactive and reminding IDHS customers about their redetermination. And finally, I want to echo an insight from one of our IDHS caseworkers who process medical redeterminations at our Ogden Family and Community Resource Center. She tells me this work is fulfilling because by ensuring our customers have their medical needs addressed, we bring stability to their lives. Sometimes it's the exact temporary support they need in order to achieve their self-sufficiency. All of us at IDHS celebrate this work because it empowers individuals and their families. So with so much gratitude to our caseworkers as well as our policymakers, thank you for including me and acknowledging this milestone with you. I'm so excited, such a celebration. It is now a very tremendous honor that I want to introduce Maria Mendez, who is an IDHS caseworker at our Ogden office. Thank you, Maria, for joining us and sharing some wonderful works with us. Thank you, everyone.
Good morning, everyone. My name is Maria Mendez, and I'm proud to serve as a human services caseworker for the Department of Human Services. Each day, it's a privilege to support the wonderful people of Illinois by providing essential services like SNAP cash and medical assistance. Growing up, my family relied on Medicaid. We were a family of 6, and having this resource allowed us to go to the doctor's office and receive medication that we wouldn't have been able to afford if we didn't have Medicaid. I recall a time when my parents were concerned about how they were going to pay for speech treatment for my youngest sister. We were fortunate enough to have Medicaid, which allowed us to obtain my sister the assistance she needed. My parents were hardworking, but we just needed a little support, and we were fortunate to have this resource available to us. So one of the most fulfilling aspects of my job is to ensure that our clients maintain uninterrupted access to healthcare through Medicaid. By diligently processing medical redeterminations, my colleagues and I strive to prioritize well-being of Illinois families. It's heartening to know that our efforts contribute to healthier communities and brighter futures. Thank you. And now welcome Ms. Audra Wilson.
Thank you, Maria. My name is Audra Wilson. I'm the president of the Shriver Center on Poverty Law, and I'm also the chair of the Illinois Commission on Poverty Elimination and Economic Security for the state of Illinois. So I'm going to repeat a lot of what's been said, but I think it bears repeating. So Illinois has worked closely with partners in the community in the planning and implementation of the public health unwinding Medicaid redetermination period, which has led to one of the most successful unwinding periods in the nation. And that's the part that really does bear repeating. The community outreach, messaging, and individual assistance campaign was key to keeping people covered. The Shriver Center was proud to work with the Department of Healthcare and Family Services to ensure that as few eligible Medicaid recipients lost coverage as possible. We worked with HFS in many ways throughout the 2023-2024 year, including drafting and disseminating joint messages for consumers through our consumer information site, Get Care Illinois, developing FAQs for consumers and providers on the PHE unwinding, training over 4,000 navigators and enrollment assisters throughout the state to assist individuals in redetermination, and resolving hundreds of individual complex cases. And we do remain committed to working with the state to keep people enrolled in Medicaid and marketplace coverage and to keep Illinoisans healthy. And with that, I'm going to turn this back over to Governor Pritzker.
Happy to take any questions from members of the media. Hi, Olivia.
I just had a question off topic about the memo last week from your deputy governor about the budget. So that there was like significant enough opposition to the proposed budget that there might be cuts. I'm wondering where you're seeing that opposition, like where is the most resistance coming from the legislature?
I don't think it's some faction or another. You know, there was some talk in caucus meetings that were occurring in the House or the Senate in which people had raised concerns or objections, some of it which is misinformation or they don't have the right information about what we're doing. For example, there's some people who think that the increase in the sports betting percentage tax is against sports bettors themselves. That's not the case. It's only on the sports betting companies, right? DraftKings, FanDuel, other companies like that. And similarly on the other matter, which is somewhat complex, net operating loss carryforwards. Not everybody's familiar with those, but we actually have lowered the tax on net operating loss carryforwards from what it had been. There had been a limitation of 100,000. We raised that limitation to 500,000, so more companies could take deductions essentially on their taxes. So, having said that, we realize that we may not be able to get to all of the members or explain it properly to all of them, and just wanted to make sure that they understood, that our leaders of our agencies needed to understand that if those new revenues don't come through, that we'll probably be hearing from the legislature about cuts that they want to make, and so we wanted to put everybody on notice. That's the real purpose of that memo. Yeah.
I just wanted to ask, you said within some caucuses, there was discussion of what caucuses.
Yeah, I think I couldn't identify them for you. I think, more broadly, obviously there are Republicans who object to some of it. There are Democrats who've expressed some objection. We're hoping that people come to a better understanding of it, or they decide to make changes to the budget. Remember, I introduced a budget in February. This is the normal process, right? It's a balanced budget. Then it goes to the legislature. It's really up to the legislature at that point to make decisions about whether they like what was in that original budget, what they might want to change. For the most part, the legislature has accepted my budgets, 90-95% of them, and made tweaks to them that they've seen fit or that we've negotiated over time. And then at the end, there's a vote on it. So my one principle around this budget is it's got to be balanced. So whatever happens here, we're not going to overspend. We're not going to, start sweeping dollars from accounts that had been done before I became governor. We're not going to go back to the old practices of, making us a credit unworthy state. And so we've got to balance the budget, and that's the real message that I think everybody in the legislature knows that I'm sending. Yeah. Anybody else? Great. Thank you, everybody. Oh, sorry.
To speak on why we're here today?
I'm happy to turn it over to Dulce if you want to. Anybody else? Do you want to take this over?
I could try.
Okay.
I appreciate it. Thank you.
Buenos días. Estamos celebrando el acontecimiento de todo lo que hemos podido lograr con las determinaciones de toda la asistencia médica. Pudimos procesar miles de aplicaciones por medio de textos y forma telefónica. y queremos seguir, tenemos ciertas excepciones que podemos continuar por medio federal para poder seguir adelante con este gran acontecimiento. Muchas gracias.
Great. Thank you, everyone.